Can you share with us your journey to discovering a better way to monitor your heart?
Back around 2014, 2015, knowing how many patients were monitoring and how many were complaining about the traditional ways of monitoring them, I started to actually actively look for a partner in the industry that was able to produce a device that would allow us to monitor patients comfortably using dry textile electrodes, essentially electrodes that are effectively built into your clothing that would also allow us to monitor you for a long time. And this slide illustrates it. In the most common and easy implementation, it's a band similar to your, garment or polar band that you would wear on your chest when you exercise. This one you can wear, both during the day and night. The electrodes are part of the fabric. They're essentially part of the conductive yarn. And there is a little pod that goes into a little pocket on the outside of the band. The pocket has the electronics, the battery, the transmitter. And the way the system works is there are 5 electrodes that produce 3 clinical grade ECG channels. Then the ECG gets sent from this little pod to your phone, and from the phone into the cloud. It's all private. It's approved by Health Canada, currently pending FDA approval. And it allows us to use it just exactly like a Holter, except don't have to shave your skin. We don't have to prep it. You can wear it whenever you feel like wearing it. You can take it off and shower. The battery in the pod is good for about 72 hours. And so,
And it's very quick to charge.
and it's very quick to charge. So the ideal workflow that we tell patients is in the morning when you go up to shower, take it out, put on the charger, shower, put it back on. By the time you finish showering in 20 minutes, give or take, it'll charge enough to last you a couple of days. We have done studies at our clinic where we validated recordings in over 700 patients. We put bands as well as there are other wearables using the same technology, and we validated correlation with conventional leads between the leads we get from the band. We also got feedback on, the comfort levels from the patients. We tested them, with the patients walking around, going on treadmill, laying down, sitting, et cetera, to make sure that it actually produces useful signal, and it does. The signal is sampled at about 1,000 hertz, over 300 hertz per channel, and it produces a fairly clean ECG. We did a study then where we had patients wear a conventional Holter as well as a Myant Holter at the same time. And we wanted to see, are the recordings identical in terms of arrhythmia pickup, estimates of your heart rates, et cetera. And what you can see here is correlation between a conventional Holter at the bottom and the Skiin Holter, the Myant Holter on the y-axis. This is correlation for the slowest heart rate, average heart rate, and fastest heart rate. And you can see that those are very, very, very close, essentially identical. Now, we did lose a bit of time. So with a standard Holter, we got about 23 hours per day worth of signal, clean signal that could be analyzed. With a Myant monitor, we got about 16 hours. Now, we looked into this further, and what we found that about 2/3 of the time that was lost was due to the patient simply not wearing it, because it's so comfortable, you can take it off, and then if you decide not to put it on, obviously we're not detecting anything. About 1/3 was due to noise. And to minimize noise, these are dry electrodes. We recommend or really ask our patients to use some lotion under the electrodes or work out. When you work out and sweat, that significantly improves the contact between the electrodes and your skin. If you put some lotion on it, it significantly improves contact. And then the new version of the monitor that we're using right now, that number is significantly better. It's over 20 hours.
When you talked earlier about how long it actually picks up for in a 24-hour duration when you actually do a monitor. So you said it only picks up so many percentage of the time. Was it 30% of the time?
Correct.
So
well, it picks up 70% of the time. It is important, and again, if you use lotion, if you set the band a little tighter, the amount of noise you're going to have is less. We've had patients exercise on treadmill up to 6 miles per hour with, very little, if any, noise. So we know it can be controlled. It's then, to some extent up to the patient as to how they wear it, if they wear lotion, et cetera.
Of course.
And we do have a customer support center that Myant organized, where if the signal that we're getting is not ideal, we actually let the patient know and ask them to make modification, make changes, put lotion on, make it tighter, et cetera,
Yeah.
to try and improve signal detection. But, the important thing is when we actually looked at the ability to pick up actual arrhythmia that these patients were having, and we looked at atrial fibrillation and flutter, extra beats coming from the upper chambers, extra beats coming from the lower chambers. The time when the patient went slow, correlation was perfect. So there
Yeah.
weren't any patients who had AFib, let's say, with one monitor, and we didn't pick it up with the other.
Gotcha.
So even though we didn't pick up 100% of the time, we picked up all the relevant clinical events.
And then, of course, that data improves over, let's go back even to when you started, it improves over 14 days or a longer time
Exactly.
that you
So the longer you wear it, right?
better, yeah.
And theoretically, there's no time limit. You can continue wearing it indefinitely.
Yeah.
These bands are fully washable. You can throw them in the laundry. They've been approved for up to 50 washes, 50 cycles. And typically, when one of our patients gets a kit, they usually get, I believe, 2 or 3 bands in the kit anyway.
Yeah.
Which is certainly enough for a 14-day period, and more are available from the company. And so these are comfortable, no shaving, longer continuous monitoring. And again, they can be set up in clinic or just simply mailed to you if we know your size. Great benefit to the clinics. The clinic doesn't have to, buy a lot of expensive equipment. It can spend more time on actually looking after you than the technical side of it. One exciting thing that we're starting to release shortly is this, is a new app for the patients. So with a new app right now, to start using it, all you have to do is scan a QR code. Once you have the kit, you have to scan a QR code that identifies you on the system. As a patient, it tells you how much data you're collecting and how much of it is good, how much time you still have left, kind of a progress bar on your Holter to collect the data we need. You can see your ECG through the app. And then on our end, we can analyze your ECG. We see a clinical grade ECG recording right here that, in this case, showing atrial fibrillation. We can also look, it's not all, I would like to think it's all about atrial fibrillation, but it's not all about atrial fibrillation. There are other arrhythmias, like extra beats that are coming from the lower chambers as a relatively common arrhythmia. And most Holter monitoring systems can't tell you if somebody's having kind of a lot of the same extra beats or if they're having extra beats coming from everywhere.
Yeah.
And it makes a difference. If you have a lot of extra beats that are coming from different parts of the heart, they're a little harder to manage. If you have a lot of extra beats, but they're all coming from the same part of the heart, we can actually go and zap that as well with one of our catheters. And so with the Myant system together with the Holter package, we can actually see different morphologies of the PVC, which makes a big difference compared to a lot of the competition. We get a lot of data on heart rate variability, probably near and dear to you. And what you do as far as stress management and kind of heart health in general. We get data on your QT interval. So patients who are at risk for long QT take medications that may prolong long QT. We get that data from the recording as well. The center that's monitoring you, the customer support center, can see how much data you're collecting, how much of it is good quality, and again, can contact you if we're not seeing good signal coming from your device. And we're about to release these irregular heart rhythm detection. So right now, yes, you can see the ECG, but right now the device doesn't tell your phone, doesn't tell you if you're having AFib. I know, and I can tell you after you've had the Holter monitoring session, but the device doesn't. And to kind of complete that circle, we're about to release an irregular rhythm detection report or heart health report that the patient will be able to see on their phone. And what that report is going to tell you is it's going to tell you your heart rates. It's going to tell you if you're having atrial fibrillation, what your burden is, if you're having AV block, if you're having PVCs, if you're having other arrhythmia. And it's also going to let you trend your factors right through your app. So kind of empowering you to participate to a greater extent in your health. And then something that's really kind of near and dear to us on the continuous ECG monitoring. And, I tell you a little anecdote. I had a patient who was wearing one of our monitors, and she was about halfway through it. She had a fainting spell, and she came to the hospital while I was on call as a cardiologist. I still do that every so often. And she told me when she had her fainting spell, I pulled up my laptop, opened up the portal where I can see full disclosure of everybody's ECG, and right in front of her could see, here when she had the pause, that's when she fainted. We got the diagnosis kind of like this immediately.
Yeah.
So really cool way of doing that. What's hidden away right now is the pod also monitors your activity, your steps, your sleep stages, your respiratory rate, and your body temperature. And coming soon in the next generation of the device, we will have slip and fall detection, oxygen saturation, blood pressure, and improved sleep and respiratory tracking. The other thing that's really cool is that the application, the new version of the application, will allow you to share your biometrics coming in with your circle of care. So for instance,
And this is how we would like to,
Right.
kind of use it, is from a cardiac rehab perspective, is that if someone has a heart event, they want to make sure, am I okay? That's the
Right.
biggest thing that people have, because when they leave the hospital, cardiologist says, okay, bye, I put in your intervention, whatever it is. And now it's like, I'm at home, now what?
Right.
And this is where cardiac rehab is so important. And this is where, devices like this are a game changer to really monitor and give peace of mind to the patient, to say, hey, you're good, or
Right.
you're not, we got to do some more, or whatever it might be, right?
And to just capitalize on the peace of mind,
Yeah.
imagine if you have an elderly parent, right? And if you can get an alert through the app, if they fell,
Yeah.
if you can get an alert through the app, if their heart rate is too fast or too slow,
Mhm.
if their breathing is too fast or too slow, if they have a fever,
Yeah.
without necessarily being there. So long as somebody is wearing it and they've shared their data with you, as their child, you'll be able to see what's going on with your elderly parent.
Yeah.
It's quite
It's
amazing.
impressive that way. So,
And
that's where I'm
yeah.
getting excited about it from that perspective. It's just a long-term way of monitoring your rhythm, and I know looking for ischemia, meaning lack of blood flow, is a little bit more challenging. We're only getting one lead, but it still would tell us, hey, I'm getting chest pain, and seeing
We're getting
rhythms
three
doing.
leads. We're getting three
Yeah,
leads,
so
but still, yes.
But it's still, that's
Yeah.
better than nothing, right?
Exactly.
Like, a lot of things have one lead systems, and they're not that accurate. So this is where I'm getting excited about it from a cardiac rehab perspective, to be able to monitor.
And from the point of view of your rehab specialists who are working with the patient,
Yeah.
they will also be able to have this kind of view, where for each one of their patients, they'll be able to trend their, respirate, their heart rate variability, and these other parameters over time, and see if the patient is kind of staying within what would be considered their baseline or deviating from that baseline in any way.
Yeah.
So I think that's going to be very helpful in that way.
And especially for patients that are on beta blockers, some of them don't need it, some of them need more. Like, this is a great way of being able to monitor.
Well, and with blood pressure, blood pressure, heart rates, I see patients and they take all of their medications in the morning, right? And then you monitor them with one of these and you see that the heart rate like super fast in the morning and it's super slow at night.
Yeah.
The same goes for the blood pressure.
Yeah.
The blood pressure is really high at the beginning of the day, and then, there's
Yeah.
no blood pressure at night, because all of these, 5 medications for the blood pressure are all on board.
Yeah.
And it makes it so much easier to rebalance these medications. Take some in the morning, take some at night. Maybe you don't need all of them.
Yeah.
Etc. Exactly as
So,
you're saying.
And it's not your fault. I mean, when you see people in the hospital and you're prescribing this, it's like in an emergent situation, you've
Right.
had this situation, and you get that everyone gets that regular cocktail. But to personalize it, this is where I think this is going to be super valuable.
And to be honest, the other thing that's very important there is compliance. Not necessarily all of our patients actually follow our advice. This allows you to really get the metrics, understand compliance better, understand what the patients actually need. They need those medicines, they don't need those medicines. No point you doing it if nobody is sort of following your advice. It works both ways, obviously.
Yeah.
And the next thing that we're working on, a couple of things. One is Myant is going to come out soon with this Care 360 package, where if somebody wants to just, if they're not your patient or my patient and they just want to be monitored, that's going to be something that people will be able to order online. But the big thing that we really are going to want to work on in the next little while, and we have a grant, we're working on it with University of Waterloo, is to develop data-driven, AI-enabled prevention algorithms.
Yeah.
We want to see, can we take all of these multimodal biometrics that are now coming from this device, potentially other third-party devices? Can we tell ahead of time if you're going to have a heart attack, if you're going to have a stroke, if you're going to go into heart failure, if you're going to have atrial fibrillation? The research in this area is quite phenomenal. There are companies now that have been able to validate AI algorithms that, based on an ECG and an O2 sat monitor, can potentially diagnose you with coronary disease, pulmonary hypertension, aortic stenosis without imaging. Now imagine you supplement all of that with continuous monitoring, with very rich signal in that ECG. Potentially, we may be able to get a lot more data from it.
Yeah, no, it's powerful for sure. Anyway, thank you very much for your time today. And
Absolutely.
that was
Great.
fun. Yeah,
Thanks so much,
Yeah.
Diamond. Pleasure chatting with you.
Excellent.
And look forward to working with you.
Absolutely. Thanks so much.